Tommy Fu, and we're from the Wharton School of Business. Today we're going to be talking about Energize the Chain, a nonprofit venture founded by Dr. Harvey Rubin, a nonprofit. Sorry, man, my bad.
No, it's okay, man. It's tough. I guess we can just keep recording.
Okay, that's fine. All right.
Okay. Whenever you're ready.
Good afternoon. I'm Casey Dougan, and this is Tommy Fu, and we're from the Wharton School of Business. Today we're going to be talking about Energize the Chain, a nonprofit venture founded in 2010 by Dr. Harvey Rubin, a University of Pennsylvania infectious disease doctor. Energize the Chain developed a revolutionary new method to store vaccines in developing countries. We harvest electricity from cell phone towers to power vaccine refrigerators in remote places. This helps us to reduce spoilage of vaccines in local clinics that suffer from frequent power outages. This self-sustaining business model operates on a shared cost savings from large vaccine purchasers like UNICEF. Currently, ETC is operating in 10 pilot sites in Zimbabwe with plans to expand to additional countries such as India, Kenya, and others. Vaccines are an extremely cost-effective global health program. UNICEF estimates that vaccines prevent 9 million deaths globally each year. They've eradicated diseases like smallpox and nearly erased diseases like polio. Countries with strong access to vaccines have better public health outcomes, which can be measured by infant mortality rates, and higher productivity, which can be measured by GDP per capita. However, there are still millions of deaths each year that stem from vaccine-preventable diseases, most of which claim the lives of children under 5 in developing countries. And the question is why? Vaccines are extremely cheap, cost-effective ways to deliver global health to those all over the world. Also, NGOs and governments spend billions of dollars purchasing vaccines and shipping them. The fact of the matter is it's not the supply that's limiting the administration of vaccines, but it's the storage. Most vaccines are temperature sensitive and require constant refrigeration in what is known as the cold chain. The cold chain is the logistical term that refers to the temperature-controlled shipping and storage of vaccines throughout the supply chain. ETC focuses on reducing vaccine spoilage during the storage phase. Vaccines are stored at local clinics in vaccine refrigerators. The problem is that these local clinics don't have reliable access to electricity in developing countries. As you can see from the data from this study in rural India, 90% of village clinics have power failures, but only 45% have backup generators. And as you travel further away from larger district hospitals, the electricity becomes less and less reliable, and the spoilage rates increase. Overall, up to 40% of vaccines spoil throughout the cold chain. This is how the current vaccine supply chain works. Vaccines are produced at a large manufacturing site. They are then shipped by air to a central warehouse in each country. From this point, they are then shipped by temperature-controlled truck to a local clinic, where then they are stored in a vaccine refrigerator and administered to patients. This is where a large number of vaccines are lost to spoilage due to frequent power outages.
So as a result, we started asking ourselves, what is a source of stable power in places that are off the grid? And what we realized was that even in the most remote places on Earth, there are cell phone towers. Cell towers are a massive and quickly growing market, so we felt they gave us two key advantages: scale and stability. First off, mobile penetration will soon cover the entire globe and is growing especially quickly in the emerging economies we target. So that really allows us to scale later on. These cell towers are also operated by private companies who have a financial incentive to keep their power stable. And they do a really good job of that by already having security and maintenance personnel 24/7 at the towers. So thus we thought, what if you identify clinics that have nearby cell towers and plugged vaccine refrigerators into them? This would in turn ensure a stable source of power, reduce spoilage, and thus solve the last mile problem. So does this concept actually work in real life? About a year ago, we put our technology to the test by launching 10 pilot sites in the high-stress environment of rural Zimbabwe. These are the photos of our vaccine fridges on the ground, hooked into cell phone towers, and as you can see, we're able to capture real-time data on how much the fridges are used, and monitor temperature levels to ensure that the vaccines aren't spoiling. Our goal was to get at least an 80% compliance rate from local clinical staff in carrying out this new protocol, and to also keep spoilage below 5%. Since then, over the past year, the co-sponsor of our pilot, Econet, a telecom company, has been so pleased that they've already actually decided to scale to 110 more sites. The point of all this, though, is to make an impact, and we actually measure that on 3 levels to get a comprehensive picture. At last year's Google Hackathon, our 12-engineer team won first prize by building Energize, which is a cloud monitoring platform built on top of Google Maps that allows us to collect real-time data from cell towers. In the event of a power outage, it can also use geotagged SMS data to triangulate the nearest maintenance personnel and fix our fridges within an 8-hour window. As you can see in the photos below, our platform already runs on multiple operating systems, including iOS, Android, and Nokia, which we found was the biggest provider in these countries. So as I mentioned, we measure impact on 3 different ways. First, via the cloud, second, via epidemiology, and third, via field studies. The cloud allows us to look at our supply chain from a high level and look at where the bottlenecks are. But we also use epidemiology to cross-match our data with monthly rates of disease prevalence from the Ministry of Health. And lastly, we get the ultimate evidence by going into the field and collecting lab samples to verify whether patients are really developing immunity to these diseases.
So as with any good idea, it's crucial that the idea is cost-effective. On this slide, we've listed the costs that Energize the chain will incur when installing and operating the vaccine shelters. The fixed costs to install the refrigerators are fairly low. All of the parts and labor costs result in a total installation spend of only $250. Note that we have not included the cost of a refrigerator here because they are already purchased by UNICEF, who already has a substantial inventory. We are simply rerouting the refrigerators from village clinics to their new location in cell phone towers. Additionally, we have the variable cost of the electricity required to power the refrigerator. Doing some calculations based on recent oil prices, electricity consumption, and the efficiency of diesel generators that power these cell phone towers, we find that the project's power consumption can be maintained for as low as 61 cents a day. These costs can be recouped fairly quickly by ETC in less than a year. So now let's talk about the value that ETC's solution can deliver to its stakeholders. Making some assumptions, ETC has estimated that each installed refrigerator on an annual basis can prevent over 4,800 vaccines from spoiling. Looking at our costs, which are relatively low at less than $500 a year, plus some small costs associated with incremental labor for local clinical staff, we estimate that we can save over $12,000 per year, which represents a 35% reduction in vials lost to spoilage. But most importantly, using some data from the Bill and Melinda Gates Foundation, we can calculate the impact we're having based upon the number of incremental vaccines that are administered. And we've calculated that each refrigerator is able to prevent 13 deaths per year. We also provide value to our public and private partners. To governments and payers, ETC allows them to reach off-the-grid populations, improve the efficiency of their vaccine programs, and also limit the impact of epidemics. For private telecom companies, ETC will allow them to digitize market data that is normally offline, reach bottom-of-the-pyramid customers, and engage in corporate social responsibility activities. But most importantly, this project has no incremental cost for them.
None of this would be possible, however, without a team with the operational experience to carry it out. I think the key aspect of our team is that it's composed of individuals who already have deep relations with all of our key stakeholders. Dr. Harvey Rubin is a world-renowned expert on biochemical thermal stability and has advised the United Nations. I've worked with the Clinton Foundation on the ground in emerging countries on multiple public health projects over the years. Brittany gets Google to power our analytics, and Judah specifically advises telecom companies on their supply chains. So collectively, we have a lot of operational experience in both the technical and the strategic business aspects of this project. The traction we've had has also been possible because we've had both public and private partners who've really bought into this project. the Gates Foundation has graciously funded our field studies and some of our pilot site building. UNICEF supplies us with vaccines. Telecom operators like Econet have agreed to be sponsors for these pilot projects. And NGOs like the Karuna Trust provide the staffing for our clinics on the ground. So this takes us to where we are today, where we have 10 operational pilot sites in 3 countries in different stages of development. First off, in Kenya, we've already completed a survey of tower conditions across the country and are in discussions with the Ministry of Health and telecom operators to plan out some pilots. In India, in stage 2, we're a little further along in that we've cemented partnerships already with these key stakeholders. We've secured funding, and we're ready to launch 6 new pilot sites next year. And finally, in Zimbabwe, in stage 3, it's our furthest stage of development, where we already have 10 pilot sites on the ground and are already collecting data on performance, such as vaccine thermal stability and vaccine spoilage. Actually, having pilots on the ground has allowed us to get a much better idea about the key risks, and we've developed some ways to mitigate them as we went along. In the field, we watch out for potential issues like theft and noncompliance, and other issues like radiation exposure, which don't turn out to be real risks according to research scientific studies. To specifically address the issues of theft and compliance you brought up, the infrastructure of having additional vaccine housing actually provides added security through things like better electronic locks that are hard to break into. Also, most of the theft in the developing world is for things like copper wire and universal parts, which our fridges don't really use. Lastly, selecting for cell towers near towns has allowed us to increase the amount of surveillance to watch out for things like theft. For example, a recent HBS study on a similar telecom operator named CellTel showed how social capital and getting buy-in from local leaders, which our NGOs help us to do, actually provides the best protection against theft. In terms of non-compliance, our 10 Zimbabwe pilots have been able to achieve over an 80% compliance rate from the personnel on the ground who are involved. And that allows us to also, besides keeping vaccine spoilage low, it allows us to increase the actual follow-ups and compliance among patients. We also de-risk on a high level by not rolling out in a country until we have the Ministry of Health on board, because the Ministry of Health has direct control over the countrywide clinical staff, and they can make them implement it effective immediately. Some other key risks are that we want to make sure to keep getting stakeholder support from whether it's more governments or more foundations. And to do that, we offer flexible pricing and operational plans to fit the needs of every country. Our proprietary cloud platform, Energize, and also being really far along in negotiations, also gives us some defensibility and room to operate compared to other people doing this. Lastly, there's always a chance that better technologies like thermal stable vaccines may leapfrog us. However, we partner with Merck, and they actually give us some intel telling us that these vaccines, thermal stable vaccines, are 15 to 20 years out, because they still have to go through things like clinical trials and sell globally. In that time, millions of people are still going to be dying of these diseases. So there is a need for this technology right now. If that day comes, however, companies like Unilever and Nestle have shown that there's definitely an opportunity to pivot our infrastructure by using our refrigeration units to refrigerate things like food and consumer product goods that are in high demand in these emerging markets. So here's our immediate timeline. Over the next few months, we're scheduled to meet with UNICEF and finalize contracts with the second wave of host countries. We're planning on wrapping up our Zimbabwe pilot, after which the Gates Foundation has already committed about $200,000 to us, which we'll be able to access to use and scale to India by launching 6 more pilot sites. After that, we plan to have enough proof of concept to raise $1.2 million of funding, which we're going to use to build another 2,300 sites across 3 new regions, and also release our own customized line of vaccine fridges that are more energy efficient. The overall goal we're striving for is to reduce most of the current spoilage and provide at least a 20% return on investment to our key payers. So, in closing, Energize Chain is a company that's already out there on the ground trying to improve vaccine chain in developing countries. We feel that our technology brings a creative enough and a feasible enough solution to really transform the vaccine cold chain and save many more lives across the globe. Casey and I just want to thank you so much for putting on this event and giving us the chance to present. We really regret not being able to present to you in person, and our thoughts are with the city of Boston. Thank you so much.
Thank you.